Okay, dear participants, welcome to our webinar, the brainstorming session we are hosting today. This is our second webinar during the Corona times. Actually, this second session was suggested by Zahid Hamid, who is one of our speakers today. He recommended us to hold this brainstorming web chat session. Thanks, Zahid. We tried to appoint 3 speakers from different countries, 1 from hospital industry, and 2 agents, two facilitators, 1 from UK. We have Zahid from UK. Okay, let me introduce the speakers first. Zahid Hamid is our oldest speaker, not oldest biologically, oldest in the industry, So he's from the UK. He is based in London. His company is called Right Choice Home and Away. He is in medical tourism business for almost 15 years, may I say?
That is correct.
Delivering English patients or UK-based patients everywhere from United Kingdom. Okay. And we have then Pierre as one of our most experienced experts in sending out patients. He's based in Paris, France, Paris. And he is working with a noisy team of medical tourism experts. They also send patients from France abroad. They specialize in cosmetic surgery, dentistry, hair transplantation. Now bariatric surgery is on the rise. We have new participants. Pierre's team is now specializing on obesity surgery.
Yes.
Guys, please keep your cameras off, except for the speakers. Turn off your cameras, please. It's slowing us down, except for the speakers. And then we have Johan. He is originally Dutch from Belgium, but he resides in Turkey now. He is one of the executive managers of the international patient departments of Memorial Hospitals Group, and he is in charge of the European markets. Not only, but one of his responsibilities is the European market. So he's Johan is the only speaker today who is in receiving patients, who is in incoming business. So he's welcoming international patients to his hospital facilities in Turkey, whereas the other 2 speakers are sending out patients from their original locations, not necessarily to Turkey, to many different countries. So many of the audience know each other already. I mean, we have only a few newcomers who don't know the others. So sorry if I kept the introduction too short, but let us go in. We had quite many topics to discuss. I mean, all of us, we have all these questions in mind, and I want to keep it as flexible, as open as possible. I want you guys to discuss and cover as many topics as you can, but Pierre called me the other day, and he was smiling. He told me that we have enough topics for a week. We don't have to cover each and every one of them, but please pick and choose some of the topics you find very vital. And let's start the brainstorming. I ask the speakers to keep it a bit short so we can get questions and contributions from the audience. I want to start with the oldest speaker today. So Zahid, it's your turn. Oldest by experience. I mean, oldest in the industry. Would you please start telling us what's happening in UK? And how do you see the medical tourism business from UK outbound? What's happening? Is it coming back? What are your observations? And let's start from there, and we'll go in deeper.
Thank you very much, Mert. Thank you for organizing this conference in the new normal, as we see it now, for the moment at least. I hope we will go back to where, what we have known always as being the normal. But for the moment, this seems to be a very workable solution. And I say this with full consciousness of the fact that the times have changed. And the reason I suggested to you that we come together and do this was because this is a paradigm shift in how we have been doing things and how we may be doing things in the future. Old habits die hard. So, yes, we will want to have the same environment that we've always been used to, but that may be some time coming. So, thank you very much for allowing us all to come back together. I didn't know when would be the next time that we may physically be together again. So, this was important. And to be honest, I mean, what I'd like to do is really give you a roundup of what happened in the UK when the coronavirus thing suddenly came on the scene and put a halt to everything, and then how we went through the rest, what followed, and where we are today. In very, very concise terms, when it happened, it was a time of being hit by something unknown, not knowing which direction it came from, and not knowing how long it was going to last, and nobody had an idea of what the magnitude was going to be. So it was pretty much a guessing game, but it called for firefighting and damage control. So we had patients in Turkey. Some of them had had treatments, others who had not had treatments. For instance, I'm saying this because a lot of the audience are Turkish. And we had to repatriate them.
Not really. We have more European audience than Turkish.
Oh, yes, I saw. I looked at the numbers and I said, I've made my first mistake of the day. Well, I'm glad it didn't cost too much. Thank you very much for correcting me there. So yeah, so it was getting the patients back from where they were and on the last flights available. So this was crucial. And it took every ounce of energy in trying to get these people back to where they had come to Turkey from and to their homes, to the safety of their homes. Similarly, in the UK, we also do provide treatments in the UK. So in the UK, there were treatments that were cancelled. And so people were obviously scared, worried about what would happen to their deposits, what would happen to their monies, etc. And to cut it a long story short, the idea was to assure them that their money was in safe hands. Going on from there, it was really just trying to make sense of the situation and keeping in touch with the customers, being proactive and going to them before they came to us, which I think was the most crucial lesson that I have learned in this period, which is you go to the client before the client asks you, and you are already streets ahead by way of damage control, by way of giving confidence, inspiring confidence, and making sure that people stay informed. So that was great. And then we learned to deal with telecommunications in a more useful way. So video consultations, etc. I have absolutely no hesitation in suggesting that this has been the savior, because no sooner have the clouds of uncertainty lifted than the patients have started to book treatments, both within the UK and to go abroad.
Okay.
And you know, that tells you that there is still the eagerness, the market is there, the patients are willing. We have just to get the environment right, and I hope our leaders know what they're doing and they can deliver a safer, more sort of akin to what we have known world back to us, so that we can resume doing our business. So we've already started treatments in the UK since the 15th of June. We have been doing surgeries, and we are doing, I mean, this conference.
UK patients in UK, right? English patients in England.
Yes. So that's right choice, home and away. So
yeah.
Home part is doing the treatments at home, and away is sending them abroad for treatment. So we've done all sorts of procedures over here in the UK. Nothing is happening in dental treatments because of the aerosol. And so for that reason, there are no dental treatments taking place. We are constrained to see only one emergency case per hour because of the sanitization rules for cleanliness of the dental suite before and after each patient. And so that means that in 1 hour, you have one patient, and that patient may be in the chair for 5 minutes. But the rules are no more than one patient. So 8 patients a day And so the dental practices over here are up in arms with this kind of a regulation. And anything else, everything else is perfectly acceptable. There are no facial surgeries happening. There are no rhinoplasties happening, no facelifts happening. So those are the things that are not allowed at the moment. Everything else is perfectly getting back to normal. I have bookings for Turkey from the 6th of July. I do not have bookings for Europe as yet. And the reason is that we are now looking at air bridges. Now that we've found a way to get out of Europe, we're going to build bridges with Europe to try and get back in. So that is where we are at the moment. I am happy to stick my neck out and say, we're getting there. We're getting back. This world will be the same as we've known it before, or we'll find a way. The human being is a very innovative creature, and we will find ways when one way sort of is denied to us. We will find other ways to get to our objectives. We will find ways to deliver what people want. So yes, hopefully things are going to be.
Yeah, sorry for interrupting.
I'm
You
happy
said you said you already have bookings for Turkey. What
Yes.
kind of patients?
These are cosmetic and bariatric.
Bariatric patients. Okay.
Yeah.
They booked or they started booking already. All right.
And I'm pleased to suggest that the survey that you had conducted, I think I was one of the most optimistic ones in that, in which I said that I see this returning to normal. Thank God for that. Thank God for that. I'm not trying to boast anything, any foreknowledge or anything else. I'm glad. I'm glad it wasn't misplaced confidence. It was just the fact that we are very resilient beings. We're very fragile too, but we're very resilient beings, and we can get things right. And I'm glad it's heading in that direction.
Mm-hmm.
Thank you very much, Matt.
Thank you. Okay, Pierre, Johan, I really don't know which one of you guys are older. So let's continue with Pierre. Not that I'm suggesting you are older, Pierre.
Well, there's been a lot of different topics addressed. What I think is most interesting is reaction to our industry. What I'm noting right there is that demands have been on the rise as soon as they heard that it was reopened. I think that the most important thing that we in the industry are worried about is what impact are we going to be able to work. I mean, we have been out of work for 3 months dry. Are we going to be starting slowly? Is it going to go like before? What is the future? I think that's the main question everybody worries about. What is the future is heading? Whether we're going to, of course, all the medical procedures, we will adapt. The medical teams will adapt. There will be hydroalcoholic gel everywhere, mask. Of course, everybody is adapting. We are adaptable people. Whether it's the medicals, of course, and the everyday people, the clients. What I think is most important is what reaction. How are they reacting? Are they willing to travel after this COVID? Are they scared? My opinion is, and from the feedback that I'm getting, is that first of all, the demand is there. The demand has not slowed down. That's the main thing. My level of demand is the same as before. So I have people asking for treatment.
Even through, I mean, the last 2 months, has it always been the same? Have they kept demanding when they couldn't leave their homes? They were under lockdown?
To be honest, the effect is exactly like Christmas Eve. On Christmas Eve, no one wants to go. No one's asking. No one's making a demand on the websites because they're busy doing something else. So between, let's say, mid-March to, let's say, for 15 days, the demand was lower. The visits were lower, sure. But once people started settling into their new lives, they still wanted treatments. They still knew that once they're going to get that treatment, there were going to be reasons for them to go abroad. We all know the 3 reasons people go abroad for. Those reasons still applied. What I think is going to be a very, very positive impact. And this is like one of the main points I would like to brainstorm about is how are people perceiving the perception of medical quality worldwide, I think will be deeply impacted by COVID, especially for European people. And I think that's one of the most important points. Because pre-COVID, we had been in a world where people's perception of their country's medical care was primarily in Europe very high. They thought French people thought that the best medical care in the world must have been in France. Netherlands, German people thought quality of my healthcare in Germany is very good, and blah 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 and blah blah blah. And that for every country. We've had very, very different ways, a different response throughout the different countries, good or bad. My country, France, being a pretty poor response and a pretty poor like government response. That's how it's perceived. And what it did is that it changed people's views towards other countries because they looked at numbers. They thought, well, I'm supposed to be in France, the super country, and we don't test everybody. And people ask questions, simple questions, and that really put back the perception of healthcare. And I think that will be a positive impact for medical tourism because people will be more open to the idea of looking. I'm not even talking about traveling, but at least looking around.
Okay. Thank you. Johan, your turn.
Yes, so...
Yeah, can you turn off your microphone? Please.
I agree with what Zahid has mentioned and Pierre as well, to a certain extent. So when there's a crisis like this, you always see that there's different spectrums. So some people say the world will never be the same, the patient number will never be recovering, it will take 5 years. Other people say this is a unique opportunity to display our country as the best destination in the world to get medical care. My feeling at this moment is that the reality is somewhere between. As Pierre mentioned, the number of VALEPs, the requests of medical care, has spiked again this month. But in June, the number has increased significantly, but still the numbers of requests of March, April, and May, those are lost. So that is a business loss that we are not going to compensate in the coming months. So if in average, for example, you receive 1,000 patients per year and you forecast 10% growth, so 1,100, these 3 months that we've lost, we're not going to compensate with additional revenue in the coming few months. So even if things will normalize again, we still in our revenue forecast have to understand that 3 months of business has been erased, and we don't anticipate, at least me personally, when I speak about these things, I speak about Johan and I don't represent the organization. I don't think that we're going to be able to compensate for the loss of revenue that we've seen in the last 3 months. I think at best case scenario in the coming few months, once all the markets are open again, for example, in the Netherlands, Turkish Airlines is flying between the Netherlands and Istanbul, but the Dutch airlines are still not allowed to fly. So there's still a huge potential of patients which is not able or willing to come because the infrastructure is not in place yet. So at best case scenario, we will be achieving numbers which are below the forecasted numbers, and we, all of us this year, will close the year with significantly less revenue than expected. On the other side, my belief is that on the long term, our value proposition is still the same. If somebody comes from Bulgaria for IVF, it's not because COVID has passed that suddenly in Bulgaria, wonderful doctors have popped out of the ground, or the price has decreased in Bulgaria, or the success rate has increased. So the criteria to select a hospital, so the quality of treatment, the price competitive, the technology, the availability, the proximity, and so on, that value proposition is still there. And it's still valid for the patients that want to make the choice. So how do we want to act?
Johan, sorry for interrupting. People
Sure.
are complaining. They cannot hear you very well. Do you have a microphone or a headphone with a microphone?
Sure, I have a headset. 1 moment.
No, please go. Save us.
Can you hear me better now?
Says, keep going, I'll tell you.
Okay. So which part of my discussion, my monologue was not clear?
No, we could hear you, but it's less clear. It's not a matter of being clear. It's not loud enough. We can.
Okay. So let me try to be as loud as possible.
It's the echo. It's the echo. You have too much echo.
Mm-hmm. Maybe it's about the room you are in.
Better now.
Try again.
So what I do feel is that in the past, for example, Turkey, for certain elective treatments, I believe that for certain parts, we are no longer the default choice.
Okay, yeah, thank you. Okay, Johan, are you sure the headset is plugged into the computer, the other end?
Yes, yes.
I think you did it now because it has changed.
It's better.
It's better now. I think you just plugged it in now.
No, I'm not using it anymore. So I'm just unplugged it and I'm sitting closer to the computer.
Perfect. Now you are perfect.
Perfect. Now perfect. Yeah.
Go ahead.
Even though I feel that our value proposition is still the same, so the quality, the price competitiveness, and so forth, I do feel that we are not the default choice anymore. A person that 6 months ago, for let's say hair transplant or liposuction, would by default would have said, I will go to, for example, Turkey, will now still in their mind have a reconsideration. What would be my alternatives which are closer? So the decision-making process to convince a patient to go and take an airplane and go to a different country has been complicated marginally. And from a marketing perspective and from a sales perspective, we have to take that in consideration when you have the phone calls with the patients to explain them why this is still the best choice and why at this moment or in the future, flying should not be an argument not to choose for a medical treatment abroad.
Mm-hmm. Okay. Zahid, a question to you. Now is a good time to do what for medical tourism professionals? We are all medical tourism people here. Now is a good, please also consider hospitals. We have equal number of hospital representatives here or clinic representatives and medical tourism agents. And okay, Arzu, I see that you have a question. Give me a minute. Arzu, I'll come back to you. So what now is a good time to do what?
Okay, I'll tell you what it has been a good time for us to do, and that was to optimize our own processes and procedures, look at the patient care pathways, see where there were gaps, and the most important thing, to work on our templates for every stage of the treatment. Yes, they need a little bit of customization here, there, or everywhere, but I think the 3 or 4 weeks of the downtime that we had, when there were hardly any inquiries coming through, our time was spent on enriching our intellectual property, on making the best use of our workflows, etc., refining them, and on enriching the content of the communication, client communication. That is what we spend time on. And I think that is something which is valid for all of the participants that are here. That one aspect was fantastic. I mean, that was something that was a great opportunity. It's something you hardly ever find the time for when you are actively involved in trying to promote clientele and pushing them through the pipeline and delivering revenues, etc. So with this kind of it was a godsend. Just like the coronavirus, this was a godsend. The time that we had at our hands to refine those processes, to work on them, to enrich the client communication. And like I said, the lesson learned about being proactive and having the workflows in place to be proactive. That was one of the best things. So I'll leave it for others to contribute as well on this note. Thank you.
Pierre, would you like to say something?
No, I think it's pretty obvious. When you don't have any clients to handle, what are you going to do? Well, you can either go play PlayStation and wait for it to happen and pray,
This is what I'm doing.
or good for you. Or you can think about how you're going to improve your workflow. Everybody had the same idea. And of course, yes, it was an opportunity to work the tools that we have to make a better process, to work the UX, all this. This is pretty obvious.
This is your answer for 2 weeks ago. I'm talking about now, here and now. I know that you are very busy in the office. You don't have time even to make jokes with me anymore. This is
no.
I'm
very busy.
So now you are very busy because you suddenly started receiving a lot of patient inquiries and bookings. They want to go. They want to start. They book for operations. Am I right? Is this what keeps you busy now? At last 1 week?
I'm busy because I've been preparing for the on lockdown for the stop of COVID. I've been preparing very hard. We've been preparing with the partners. We've been going ahead and knowing, or believing anyway, that it will reopen. And we've actually made a shift in the way we are dealing with the clients, and it has been a very positive shift. And we are very busy because yes, not only do we have demand, but we also have bookings. So we have to get these people on the planes. And actually, we had people. We've had our 6 first clients on the week of June 22nd.
Flying where? Flying where?
Flying.
Flying
Turkey, Turkey and Belgium.
Turkey and Belgium, okay.
Turkey and Belgium, and we actually, like, in the next week we will have all throughout Europe. I'm talking about Spain, Portugal, Hungary, Tunisia this summer too, Turkey, and we have other countries such as Thailand also, but it's more like into the end of 2020.
Have you discovered new opportunities during these hard times in medical tourism business? Any new ideas, any new possibilities that you have realized during these?
Well, I think Zahid talked about it a little bit, and I think it's a change in medicine in general. Is that the telemedicine, the medicine through a screen, is something that, well, we're not bragging, but we have been doing this in medical tourism for a while, haven't we? We actually have a know-how in that prospect. So any new ideas, I wouldn't say that it's really new ideas. It's just perfecting and actually normal local medicine, using the tools that we have been using. So in the end, when we do the telemedicine that we used to do, people are getting more used to it. This is why I say that I think medical tourism, just medicine in general. I mean, I've been a very big advocate of saying that medicine will grow worldwide. It's already like that, but it will be, people will, in the very close future, people will be looking at where they get their healthcare, not locally, but worldwide. I mean, it will happen. And within my lifetime, I really strongly believe, and this is just a leap forward. Because people will get used. I'm just finishing this. People are getting more and more. They're already doing telemedicine with their local GP. So doing a telemedicine or teleconsultation with a dentist or a hair surgeon or even oncologist is going to be something that is going to be more and more common. Making it more common makes it easier for everybody.
But do you think we can make the same money as medical tourism professionals? We can make good money or the same amount of money through telemedicine? When we actually send a patient physically, we know how to make money, both hospitals and the agents. But in telemedicine, are the patients willing to pay? Are there methods of making good profit from telemedicine? Because for example, I'm an event organizer, and you guys pay me when you come to my events. But for this webinar, nobody pays me, and I don't expect to be paid. So if we send a patient actually to a surgeon in Tunisia, in Poland, in somewhere in France, the patient is ready to pay. With the patient pay for teleconsultation, with a doctor in Hungary, a surgeon in Israel. Is the patient ready to pay?
Can I just answer that?
Who is Zahid? Yeah.
Yeah. Okay. Just one point on what Pierre said. I totally agree. Yes, telemedicine has been there. What has changed is people's perceptions. What has changed is Zoom is now so widely used that people were ready at the suggestion of a video consultation. So we've been doing in our treatments at home in the UK, video consultations for treatments in the UK. What did that do? It cut down the cooling off period. So there was no cooling off period required after the hospitals became operational and people could go into treatment straight away. But even for abroad, we have been charging for teleconsultations. But to answer your question, we have been charging for teleconsultations, and I believe that if you are convinced that you are offering value and you make the proposition of that value to your potential clientele, your audience, they will pay. What is it that I'm getting out of it? If I get people like Pierre and Johan sitting here and you conducting an event, and I get an enrichment of my thought process, why would I not pay for it? The price has, and you have to be convinced. I have to be convinced that I'm offering value in a video consultation.
Next time, Mert, I'm asking to be paid.
Absolutely, we are contributing.
So, and Mert, I want to mention something about this.
Please speak closer to the computer.
Yes, from a hospital perspective, and also from an agency perspective and patient, successful treatment is the right patient with the right doctor. So sometimes on paper, you can give all the information to a patient about a doctor, a treatment, a hospital, a price, a treatment plan, but the patient is not convinced. So if that patient then has the ability to have a 5 or 10 minute Zoom or Skype consultation with the doctor, the patient will be able to make a decision. So for us as a hospital, it's not as a pure source of revenue. It's as a tool for patients and doctors, and of course the marketing department, in order to connect the right patient with the right doctor and then schedule the treatment.
I see. Okay, Arzu has a question. Arzu, would you please keep it quick?
Yes. Thank you so much. As I said at the very beginning, before the whole conversation started, I am just out of a hospital. I've been hospitalized for 3 days, and I'm telling you, because I'm celebrating my 10th year this year in medical travel, and I'm having incoming patients from all over the world. But now we have a different direction, as all of my colleagues says. Now, Zahid says, and I respect his ideas and recommendations always. He says he has booking for Turkey for July. What I would like to hear, what will my dear Zahid, who is our mentor for all these years, what will he do differently than the other? Because now I was in the hospital, I couldn't have any of my family and friends visiting me. I couldn't have even someone staying with me because he had to has, my husband had to has, a COVID test and so on. There are a lot of difficulties ahead. I'm trying to keep the positive side, but just being out of the hospital, there are things quite hard. I would like to hear the solution from Zahid, Johan, and Pierre, and all the other partners in the field, that how we can cooperate internationally. Now there is a tremendous demand, as Zahid says, and also the hospitals or the medical travel agencies are 3 months dry, as Pierre says. But now what needs to be done differently? How could we change our regular way of doing business, and how to improve our work? That's what I would like to hear. Yes, telemedicine is great, but you know, having a stomach bleeding, you cannot do much. Or if you are having a cancer, brain tumor, again, the telemedicine can help you up to a certain point. Now I would like to hear what needs to be done differently. For example, Zahid, what will you do different for your bookings in July for Turkey, where we can learn?
Okay.
And I agree with you. There is a paradigm shift. I'm just out of hospital. I have seen it. I have unfortunately experienced it. And there is a new normal.
Also, can you summarize, please? Can you come to the
Sorry?
question? Yeah.
I don't understand the question.
Yeah, the question is, what will be doing differently in terms of medical travel?
Okay, so these speakers, you are asking them, especially particularly Zahid, what he is going to do different than before the COVID period, before. Okay.
Yeah, and what will they suggest for the medical travel companies or hospitals in Turkey?
Why only in Turkey? Listen, this is an international event. We have more participants from Spain.
Sorry, I have been doing incoming for Turkey. Okay, let's say for any other country, what we need to do differently.
Okay.
Now, because there is a huge demand, but there are hospitals to ready and hunger to take the patients. And what will happen to the medical travel companies?
Thank you, Arzu. Thank you for the question.
Thank you so much. Thank you. Bye-bye.
Okay, so thank you very much for that question, Arzu. That is an important question. And the answer is simply what has changed? What has changed is that there is a COVID environment now. What that means is that there is an emphasis on social distancing, there is an emphasis on testing, and there is an emphasis on protection. So these are the things that have changed. In terms of my patients, I mean, the willingness has to be there. I'm not forcing people to go. I cannot, right? That's out. If anybody wants it, they will find a way and they'll get there. They'll have the treatment done. They don't need me, right? So the whole point about medical tourism is you can't, it's not like selling a Lamborghini. You're not. You are furthering the feel-good factor, the well-being of a patient, and you're doing it responsibly. And this is the principle that has to come to bear upon all actions that we take. The first and foremost for me is to make sure that they are informed about what the conditions are at the point of delivery of the services. So we don't have arrangements with any European country at the moment for there to be no quarantine when the patients land over there. There are flights available. So you've got Wizz Air, you've got other airlines flying into European destinations, but there are presently no arrangements with them. And so you have to go into quarantine if you are traveling to those destinations. So it takes medical tourism out of the equation.
Can I add something?
Please.
Sure.
Sorry, Zaid. I'm just interrupting you very quickly because in the question there were two factors: medical tourism for brain tumor and medical tourism for any comfort comfort operation, dental, hair transplant. You cannot compare the two. That's the first thing. When we talk about comfort operations, cosmetic surgery, dental, nothing urgent. Well, medical tourism is an option, and medical tourism, no matter what we do, cannot treat everybody. Okay, so there is something where there's a matter of urgency. We talk about telemedicine, and Johan was very telling about how do you convince someone to come through telemedicine, and having that Zoom will help a lot. Hello, Jamal.
Hello.
Will help a lot. For sure, but when you get someone who's coming for a liver transplant, brain thing, or things like that, and there's a matter of urgency to it, I mean, we're not talking about medical tourism. We're talking about healthcare, period. Because if someone's coming because of liver transplant or brain tumor, I mean, there's such a matter of urgency is that they're actually coming usually because there's a problem of availability of treatment.
Okay.
Usually. So I just wanted to add this because I think, as Zaid said, he said very, very, very rightly, he said, we have to do things responsibly. And doing things responsibly means we can't treat everybody.
Okay.
And I think that won't change.
I have a question from Olga, especially to Johan. But before that, Philip, are you here? You said something interesting on the chat. would you please shortly address to everyone? Hello, Javier. And then tell me, it was an answer to my question, I think, Philip. Can you turn on your microphone and contribute shortly? Okay, he's not here anymore, or he's not listening to me. Okay, Olga's question to Johan, particularly to hospitals. Okay, Johan, how do you plan to host patients? Any new roadmap after this COVID crisis? Have you changed anything? I'm sure you did.
Well, like probably everybody knows, things over the last 2 months have been changing continuously. So at one moment, this is the policy, then this is the policy changes, but at this moment it's fairly stabilized. When the patient arrives in Istanbul, they do a COVID test. And based upon the outcome of that test, we can proceed with the treatment. So for example, if somebody tests positive, then they have two options. Either they go to, it can also go before indeed arriving to Istanbul. They can go to a devlet, a government hospital, or they can go to a private hospital for treatment. Once obviously the patient is negative and they go to the hospital, as Zahid mentioned and as Arzu mentioned as well, there's certain limitations. So the guests and the visitors, those are no longer allowed. We cannot have people staying with multiple people in a room and having visitors, because that would increase the risk.
Even accompanying people for certain surgeries, they need an accompanying person to help them with the treatment sometimes.
Yes. So initially you have to stay in the hospital. So you cannot just go like in the past, staying one day in the hospital, then going to the hotel. There also is a difference between elective treatment and non-elective treatment. So the roadmap, it hasn't changed too much. You know, if you have a treatment which requires you to stay in a hospital for 2 weeks for the treatment, you still have to stay in the hospital medically for 2 weeks. So there has not been too much change. It's only you have to make sure that you do a COVID test and that COVID test is negative before you start with the treatment.
Okay. Are patients afraid?
Mert, for our patients going abroad, what we are doing is for Turkey, for instance, I'm liaising with the hospitals over there. Until last week, the policy was no hotel stay. You have to stay in the hospital. So it was a full 6 days of hospital stay before they could leave. That was one. The second thing was we had made arrangements for our patients to have a COVID test within 96 hours of before their arrival in Turkey, so that they have something to say, I've tested and I'm negative, and I've been self-isolating since I've had the test. So they can go directly into their treatment. The whole point is take the uncertainties out. So why should I travel with the uncertainty that I'm going to land at Turkey and then I'm going to have a test, and what if it comes positive? I'm done for 14 days, 15 days. I'm not having any treatment. And that's a minimum. And then, you know, so those are the uncertainties that need to be removed. This week, they've done away with the hospital stay, and now patients are being allowed to stay at hotels after the necessary hospital stay, according to depending upon the procedure that they are having. So that is what you know. So it's really coordinating with the hospitals, and hospitals need to be forthcoming. I will not name a hospital, but there is one hospital. I receive emails from many, but there's one hospital in Turkey that has kept us informed throughout this process, throughout these last 3 months, of what is happening, what government regulations have been passed. You know, all this thing about now it's been dropped, but only certain hospitals were allowed to do treatments for foreign patients, but that's again been taken away, which is a shame, really, because I think one of the things that needs to be put in place is this kind of regulation. And there was the necessary communication of patient information to the Turkish government on a portal that had to be done, which has again been taken away. That is also not necessary anymore. So, you know, I think we are coming back to normal, but these are the things that have to be done. COVID testing, conditions over there. Patients over here in the UK cannot go and visit their companions, cannot go into the hospital even. They can't even go to the waiting rooms. So they're having to stay outside. and just come and pick them up, when they're done with the treatment or they're about to be discharged. There are no consultations taking place in hospitals at the moment.
One question to Pierre and Zahid. Okay, some of the European countries have suffered more, namely Italy and Spain. Okay, we have participants from Italy here, from Humanitas Hospitals. We have Gianluca. And from Spain, we have many colleagues. And also we have Alessio from UPMC Italy. And then from Spain, we have many. I don't. Okay, let me not. So forgive me for not mentioning names one by one. So these Spanish and Italian hospitals are now wondering. Actually, they are asking me on private chat, what is the perception about these destinations? Do you think patients from France, Pierre or Zahid, do you think patients from UK are afraid to go to these countries now? Do they hesitate? Or medical tourism is not much affected?
May I take the first lead on this?
Please go ahead.
Yeah, this is about people's perception, and for me, it's most important. And I think that anybody who was afraid of going, who would be afraid of going to Spain, would not have a treatment abroad anyway. Or we're talking about a very small margin. I mean, not everybody is willing to have healthcare abroad. That's granted. Some people are like, it's for them, it's a wild idea. I don't think that, I mean, COVID has affected absolutely everybody. Everybody was on lockdown. Everybody knows that there's been different government ways of handling it, good or bad. That put that besides, for the survivors that we are, if someone is saying, I'm not going to go have healthcare in Spain because of COVID, it's not a loss, because this person would have not gotten healthcare abroad anyway.
Whoever can travel to Poland for medical care can travel to Spain too. This is what you are saying.
No, what I'm saying is that the people who are going to get the argument of saying, oh, I'm afraid of your country because of COVID, because, oh, I don't want to go to Spain because there has been a lot of cases, is not someone who is going to get healthcare abroad anyway. It requires a minimum of, I'm sorry to say this, but it requires a minimum of intelligence.
Or courage.
Okay? And
courage.
sorry?
Courage.
No, intelligence.
Okay.
I mean, no. Let's just fucking, sorry. Let's say what it is, okay?
We'll pardon your French, Pierre. We'll pardon
no. Yes, pardon my French. Thank you. Because I get very, very angry at people like that. And when they waste my time or my staff time, I tell them, listen, you're not ready to go abroad, okay? You're not open-minded enough. You are afraid of different cultures. You're afraid of Spain because what? Because you think that they've had like 200 cases more than France. This is never going to be a client for any of us anyway.
Okay.
Okay, if I may take it from there, if you really want to know what the people in the UK are thinking of right now, they're thinking of their next holiday in Spain and in Italy. Right? I can assure you of that. Okay. That is, that's
yes.
how hard habits die. We can't wait to get on a plane that will take us to the beaches, to the sunshine, to the sand.
Okay.
That is where we are at the moment. Yeah.
Okay. So you see,
as far as, but let me just correct a perception. A lot of noise has been made about how bad things were in Italy. A lot of noise has been made about how bad things were in Spain. Let me correct the perspective. I think if there is any country that had it worst, was UK.
Yeah, your prime minister was infected.
6 million people, yes, and nearly 100,000, over 100,000 dead, right? I mean, how do you explain that? How do you explain that? And we get away with it, right? Okay. Now, the point is very simply, last week, and this is a short answer. I don't want to hijack the discussion into another direction. Last week, we had the lowest number of deaths in any week in the last 5 years.
How many?
Because a lot of old people have died.
Mm-hmm.
And we are known to have a very old population, as did Italy. We have a very old population. It's people with comorbidities who died, right? If you look at people under 65 years of age who have died in the last 3 months of COVID, it's only 350. That's fewer than the number of people that die of drowning in a year. Does that mean we stop people from swimming? Right? So,
Yeah, but it's
prepared.
I agree, but it's a different debate.
It is a different debate. Leave that aside. I'll leave that aside. I'm coming back to the point. Anybody who is prepared to travel abroad for treatment will travel abroad. I've already had a lady, mercifully not from our company or through our company, who has been to Turkey, came back because she lost her nerve and didn't go through the operation because she was worried for her children, not for any other reason. She's come back, got in touch with us, and wants to have treatment in the UK.
Okay.
But this is nothing to do with Corona. It's exactly the point that Pierre was making about people being either prepared to go abroad to have treatment or not. You accept it, you're confident of it, and you are happy with the arrangement.
Okay. We have Javier from HM hospitals in Spain. They are from Madrid, Barcelona, and some other big cities of Spain. He's telling us on the chat, in Spain, there are no restrictions for international patients. They are allowed. If the flights are allowed, they are welcome. So, I mean, don't you do the PCR testing, Javier? I mean, don't you even test them? Well, okay, he's texting. Johan, any comments on the last discussion? Johan,
your microphone's off, Johan.
You mean with regards to the number of casualties of elderly people in the UK?
No,
about holiday in Spain.
Okay.
I completely agree with Zahid. In the Netherlands and in other countries, people are concerned about, am I going to be able to go on holiday? So the concern of us of not growing the business again is, as I mentioned in the beginning, it's not needed. People want to travel. And as soon as all the borders are open and all the restrictions are gone, people will come again. And of course, there's a certain part of the market that will be afraid, as Pierre mentions it and Zahid mentioned it, but the bulk of the people that want to go abroad for treatment will still come abroad. So that's in short my vision.
May I add something? Are you finished, Johan? Yeah. Sorry. Hello.
Yeah, we are with you, Pierre.
Hello.
Yeah, we can hear.
Yes. Sorry. Okay, there is something that I think since we are like so many professionals, there's something that I would like to drop in everybody's ear. And in my country, in France, the government's communication has been very, very bad for us, for medical tourism professional, for outgoing tourism as a whole. They've been lying to people. That's the truth. They have been lying, telling people that as French people, they will not be allowed to go outside of the borders. They were mixing two things. They were mixing foreigners going into our country and our nationals going out. And in the way they phrased it was that people thought that they were not allowed to travel, which has never, ever been the case. I mean, during COVID, there has been flights out. My uncle went to LA in 1st of April from Paris. Okay, so there has been flights out. There were way of traveling, but the communication of governments, I don't know if it's the case in the UK and the Netherlands. I don't watch the news there, but in my country, the communication of government has been lies. And we as professionals, we must tell our potential clients that they're allowed to travel, because my clients say, I would like to travel, but I'm not allowed. Yes, you're allowed. You can take a flight. So people are not aware. And if I may drop in everybody's ear, if we want to get our, well, the end of the year decent, we must communicate as a whole. Everybody communicating will benefit all.
Mhm. Mhm. Okay, two answers from Spain. One from Javier to my last question. He is telling us, we request test at the arrival to the hospital from the patient, says Javier from HM Hospitals. And we advise to the patient to be tested before traveling, even it's not, I mean, although it's not mandatory. And Mamen from Murcia, she is telling in Murcia, in their medical spa resort and some other hospitals, they perform COVID test for free. And also before they do it before the medical treatment in the hospital. All right. One question from Sorin from Romania. He is an old colleague. Some of you may not know him. He has stopped performing actively being in medical tourism for some time. He asked me on private chat, what do you guys expect for the coming autumn season, when it's the flu season again? There will be ordinary flu, which will be confused for COVID, and there will be another panic. There may be another panic or crisis. Do you think that the second wave or the perception of a second wave, the hallucination of a second wave may affect our business? Let me finish this question with my own question. Do you think we will be able to perform our medical tourism business as before next year? This year, I don't think so, but next year, or when do you expect it to be up and running as before, just as before? Will it ever be the same again?
Okay, since the others are not jumping in, I will do so.
Go ahead.
Okay.
We know you're the sharp one, Zahid.
Sorry?
We know you're the sharp one, Zahid.
I'm the sharp one. No. I'm scared of giving you too much time in the ring, you see, because
No, go ahead, please. You are a good speaker. We enjoy listening to you.
Thank you very much. That's very kind of you. I think we need to learn to live with it. We need to learn to live with COVID. It is here to stay. It's not going to go away. We are talking about a vaccine. A vaccine is still far from being put out there for the general public. They say it's being tested in Oxford and by the UCL, University College of London hospitals. But let's see what happens, what comes of that. This is something that we will need to learn to live with. That's number one. Number two is that there now needs to be a contingency plan at the back of our minds and in our closets that can be pulled out at a drop of a hat, and we can implement it when such a second wave or any subsequent pandemic threatens normalcy in our lives. I think that is the biggest lesson that we can learn and take away from this, that we can't take things for granted anymore. We need to figure that this is going to be a fact that we need to learn to live with. So that is the thing that needs to be done. And how to then, what are the elements of this contingency plan? Firstly, it's the damage control. It's damage limitation, and making sure that we can continue to deliver the promise, or if we abort it, then it is done so with minimum damage in terms of costs, in terms of time, and in terms of patient displacement. Those are the things that we need to take care of and make sure that we can deliver on. So I think that's the prime thing. And I believe that there will be a second wave in the autumn. To answer your question, there will be one, and we should be wary of it. And if we suspect anything of that sort, we need to make our clients wiser on it and not keep it from them. Just like so many facts, as Johan said, have been kept from us, with the governments not being forthcoming and sharing information, or fudging the figures as it is, which has been happening. So we need to be honest with our clients, and this is an ethical service that we perform, and it's very important that if we benefit from any piece of information that impacts on patient journey, patients must be taken on board and be told about it.
Okay, Johan, your turn.
Something to that. Of course, so simple
Can you get closer?
is that in case there's a new
Johan,
outbreak of
Johan,
Louder, please, Johan.
come closer to the microphone, please.
So yes, for me on a personal level and also in my position, one of our key criteria is that in case that there's another outbreak of COVID, that the non-elective treatments, so you're talking about organ transplant, you're talking about oncology, you're talking about cardio and so forth, that these patients can still continue their treatment, because in the last few months, many of these patients that were supposed to come for treatment were not able to come. And obviously that can have disastrous results on their well-being and even their life. So that is the first priority for us, to make sure that whatever happens, these non-elective treatments can proceed with their treatment, or they can be planned accordingly, that they will be fine. Secondly, the elective treatments, well, there you can play more with time. If somebody comes for a hair transplant, if there's certain conditions and regulations that the patient has to wait a week or a month, you can do that because it's not life-threatening. It will not impact the life of the person like that. Your question, do we expect a second round of COVID? Everything that I've read so far on international media suggests indeed that a second round of COVID would come, but also everybody writes, and all the analysts and scientists mention that the second round would be less impactful because we are much better prepared with our infrastructure to predict it and to ease and soften the blow.
That's true. Yeah, if I can add just a final thing, everything that was said is perfectly right, and I would even further what Johan just said about the second round of COVID. I think what this crisis has taught us is that we can be stopped by a massive, big flu, and it has taught us. I take it as a warning from wherever. Very quick story. I had a motorbike accident once in my life, and in this motorbike accident, I got very, very close to be paralyzed. And it so happened that I hurt my knee. I lost a ligament, but I thought, hey, I paid a ligament, but I could have lost the ability to walk. And I thought, this is a warning. And since then, I drive more carefully and I am more aware on my motorcycle. And that's the exact same thing. Now we will carry on business, but we know in the back of our head that it can happen. And we will be more prepared. It's a warning. It's a not too expensive warning. It could have been far more expensive.
Come on, Pierre. We have lost money. I have lost the whole year. You have lost 3 months.
What? Yeah, exactly. You've lost a couple of months. But what would happen if it was much more brutal than that?
Yeah,
now you will be prepared for a much worse virus. I mean, I hope it's not going to happen. But if it will happen, you will be more prepared. Why? Because you had this opportunity to think about what other solutions you can come up with. You know, you start with those webinars. You may develop it. You may develop new ideas using new technology. That's what's going to happen. And it costs you. It costs everybody. But this cost is actually, it's not just free loss. It's a cost that we pay to get better.
Okay. We have finished our 1 hour. So let's give to some of the audience who have questions, but I will kindly ask you to keep it short, please. Roman from Israel, from Löwenstein Hospital. Would you please keep it short and contribute?
Yeah, something short. Hi, everybody. I just wanted to say that COVID, that I agree with the people that spoke about the COVID, that it's going to stay with us for a long time. It's like an instant issue. So the COVID, I think that from the marketing point of view, we need to give people, to say them that they are safe with us, that if they come to us, they are safe about COVID, because it's going to stay with us something like I hope not more than a year from now. So we need to give them feeling that they are safe from this point of view. This is my opinion.
I see. I agree. Philip, are you still here? Please don't go.
I'm here.
Ah, finally. Okay. You were saying something about the telehealth, telemedicine aspect. Am I right? Would you like to take it from there?
Yeah, absolutely, absolutely. Because one of you mentioned that, no, you asked this question an hour ago. If there is, what will happen to the agents, facilitators, if the patient doesn't have to, you know, have this direct connection to the hospital and the traveling, correct? So there was this conversation earlier here. So yeah. It's absolutely clear it should be clear to everyone that a good telehealth system, if it's set up in a hospital, the agent is obsolete. The agent in between, correct? Because that's the idea of telehealth.
Is it? Telehealth, especially in Israel, I know many who provide this platform, who provide infrastructure for the telehealth. This is what they do. And this
okay, infrastructure, technical infrastructure, of course. Yes, the IT background of it, but you in your current role, correct? Mert, you as a typical agent as it exists today, and Zahid will maybe share my opinion here. The job of a typical agent will have to adjust to the new ways of working with patients who are seeking for medical advice at home. So what Pierre is doing, you know, what we are doing as agents, this has to change in case there will be a travel ban.
Absolutely. I mean, but facilitators has been a changing a work for many years. It has been adapting to the more and more freedom and more information being available. And definitely, Philip, we facilitators, as it was, which was basically a travel agency for healthcare, is going to change. Yeah. To where? To what aspect? Well, that requires creativity, and everybody's going to have their own ideas and develop the way to do it.
May I have permission to speak?
Please do.
Well, thank you. First of all, Pierre, I had the same accident, and what it taught me, I never go on two wheels again. And no, but I don't drive a bike anymore. But anyhow, I agree with Philip. The infrastructure is very dangerous for all of us because it gets us out of the equation. Hospital, agent, patient. They could. It is very. I see it as a very dangerous thing for an agent. Hospital, the one that establishes the infrastructure, the hospital that establishes the infrastructure for video conferences and whatever, needs less and less the intervenience of the agent. So that's a dangerous thing. From my perspective, for what I see, what we have to do now, and here's Dr. Hamid, I agree with every word. Do whatever you haven't done for the past 1 or 2 years in promoting your business, in preparing marketing campaigns for the future, because you could be doing it very fast after it's done, and save money. Save money. That's it.
Okay. We have a question from Spain. Yana Alexandrova from HLA Assiser Group. She wants me to ask, is there a place for medical tourism as an industry to help regain the patient's trust towards traveling for health by creating more positive PR about the best practices in the treatment of COVID in different countries, in different hospitals? Is the question clear? I mean, okay, best practices of treating COVID in different hospitals. Can this be a PR? Can this be a marketing tool for attracting patients or for gaining trust of patients? I don't think so myself, but there are other experts to address on this issue. Johan, would you agree? I mean, do you think you can gain trust of patients?
From a marketing perspective, I would not promote our specific COVID treatment. What we would promote and what we do promote is the hygiene that we display and use in our hospitals in order to make sure that our hospitals are tip and top and that Corona is not there. So that is something else. That is the service level that you provide for your patients to prevent something like this to happen, and not the specific treatment plan of Corona. Because we would not promote foreign patients to come to us with Corona to have treatment here.
Okay. But okay, my point of view, medical tourists, they usually travel for surgeries, either cosmetic surgery, dental surgery, or vital surgeries like oncological surgeries or orthopedic surgeries. They are not much worried about Corona actually when they travel. Corona is a very basic healthcare problem case. So doctors or nurses or physicians dealing with Corona in hospitals, they address to a different clientele. They do not address to our clientele. Medical tourism patients, medical tourism consumers are a different category of healthcare consumers. This is what I think. So best practices in Corona treatment, in COVID treatment, may not impress our target audience, our clients, I would say.
Mert, this is Jana Alexandrova. May I speak, please?
Please go ahead. And sorry
Yes.
for misspelling your company name.
No, it's a sister group. My question, maybe you misunderstood my question, but I was not referring sharing best practices in order to attract COVID-19 patients. My question was different. I think that medical tourism is a way to make our healthcare, the healthcare that we deliver more and more global. And I do believe that medical tourism could also be a platform of exchanging experience among hospitals, among practitioners. And I do believe that in doing so, what the medical tourism traveler who does not necessarily has COVID will feel protected no matter where he goes to get a specific selective treatment. I was just wondering what their experts think about that. Do you believe that we should create these bridges, this platform starts, not only having our own PR about how good we are in the IV treatments or cardiovascular surgeries, but maybe share this type of experiences too? Do you think that will affect positively the lost trust? Because the patients are not afraid to come to Spain because they're afraid that they will get worse treatment. They're afraid to come to Spain because of COVID, and that affects the tourism in general, not only our healthcare delivery.
Actually, the speakers have said the opposite. They believe the patients are not afraid of coming to Spain because of the COVID. This is what I said 10 minutes ago.
Yeah, this comes back to what I said earlier about government communication. When you have a government that says this year you will spend your holiday in your own country, well, unfortunately people think that they're not allowed to go. Not just this today, there was a report about the price of holiday estate, Airbnb estate in France going up because people are only renting places for their holiday in around Bordeaux, which is like 300 kilometers from Spain. Sorry, I got a call that interrupted the Zoom. I'm sorry. So what I was saying is that the prices of the holiday estates was rising to crazy levels because people thought they were not allowed to go to Spain because the government said, do your holiday in France.
Ah, she keeps calling. Johan, are the prices increasing? Treatment costs, because of the COVID crisis. The prices are they increasing?
We have not increased our prices. No. A treatment price which was, let's say, $5,000 or euros 4 months ago is still the same price.
Is it a policy, or are your costs the same? The consumables?
A COVID test is not very expensive. So if somebody comes for a complex treatment, which is $5,000 or $10,000, then a COVID test is not that costly in order to change that price.
Yeah, but you have now new regulations in the hospital, new precautions. You have to use different types of consumables. So I see that they are not much different than before.
Obviously, I have to mention here that I am not involved in the purchasing department, nor am I involved in calculating all the cost of the materials used in the treatment. I'm involved in the marketing, the sales, and the pricing. So we did not change the prices that we're using now compared to 5 months ago.
Okay. Okay, guys, we are good to go. It's more than 1 hour and 15 minutes now. I know that some of us can speak longer. I would kindly ask you to make the conclusion remarks, starting from Zahid, ending with Johan. So you're in the middle. Zahid, would you summarize today's speech and tell us the conclusion remarks?
Thank you very much, Mert. Thanks for organizing a very purposeful conference. I think it was very timely. And I think it's been a good exchange of ideas. And it has allowed us to basically ratify our own understanding of what lies ahead of us and be prepared for it. There are lessons to be taken from our experience. And there is a need to put in place measures to make sure that we are adequately prepared for the future. So thank you for enabling this exercise. Thank you all.
Thank you. Pierre. Okay, Zahid kept it very short, so feel free to take it.
Yeah, I didn't expect Zahid to be so short.
Come on, don't do this.
Well, no, thank you again, Mertrin.
Yeah,
oh, come on, we know each other for a long time. We can allow that kind of joke. Okay, well, thanks a lot, Mert, for organizing it. That was very fruitful, and I think that we got some good ideas going. There is no end hope besides hope. I think we have learned a lot. Everybody has learned, has been forced to learn, and we are reopening. We are crossing fingers. The demand is there. So since the demand is there, the flights are starting to be there. They're starting to go on time. So providing that we don't have another wave coming in and slapping the rest of the year off, or another virus, which we will deal with anyway, because we are not going to be able to have a country. I mean, I really do not believe that they will put the economy on a hold down like it was again, because I don't think any country can actually afford it. So let's have hope. The demand is there. People are willing to travel. Let's work.
Okay. Johan, your turn.
So the same words. I also believe, and I see in the numbers, so the number of requests, the visitors to our website, the traffic that we generate on our CRM system, that the demand is there. The conversion to actual patients is coming there as well. As Pierre mentioned, is that we are ready for the next event in case that would happen. This forces us to be better in our marketing, in our sales, in our patient care. So I'm in that sense very optimistic that the remaining of the year that we can be strong in our results and revenue growth.
Thank you very much. So thank you, dear colleagues, for joining. Thank you, Sihem Ameur from HM Hospitals for thanking me. We should stay in touch. We should keep organizing more maybe brainstorming sessions. I found it very informative today. Not as good as our actual gatherings, physical gatherings. But still, if this is the best we can do, let's keep doing them. I thank you I thank to our speakers for your contributions and to everybody who asked the question. Goodbye and see you soon, hopefully.
Bye-bye. Thanks.